Joining me now from Modena, Italy, is infectious diseases specialist Dr. Giovianni Guaraldi. Dr. Giovianni, thank you very much for your time.
My pleasure being.
I understand your hospital there, where you are, you've been treating patients with COVID-19. What's the current situation like right now?
And so, of course, we are in a phase of the epidemic in which most of the suspect cases are in fact confirmed whenever they are tested. And so nowadays, what is our priority is really to identify the patients who are at greater risk of respiratory insufficiency and try to prepare some situation in which we need to admit only the patients who are at risk of developing respiratory insufficiency and be able to face the need of invasive respiratory assistance. And so what is important in this situation is not to have the population get into panic and be able to treat all the people with low symptoms or asymptomatic, be treated at home. And so it's of our crucial importance now to work together with the territory so that to understand who are the people who need to go to the hospital and who are the people that can be treated at home.
And we know that this virus is quite challenging as we're continuing to sort of try and learn more about it and how it affects one person versus another. And there are another number of factors involved in that. Where you are, the country is in lockdown. Do you think that is the best measure at this point as you know, and other health officials are working to sort of treat those? Do you think this is the best measure to contain the spread?
So I cannot really say there is a proof of evidence that this will work, but for sure it has been finally understood by population that what they need to do is stay at home, because it was not enough just to say close a school. People were still gathering together, and so what was really needed was a strong message to say to people, do not gather together, stay at home. So far, this is the best way in which we can control the epidemic.
When we look at the numbers right now, 11 days ago, Italy had about 500 cases. You're now at 10,000, more than 10,000. What is the concern here? Do you feel that the system is going to be overwhelmed?
So I can say that so far the healthcare system, is still coping with this epidemic. Of course, lots of measure has been done and all the structure of the hospital has been completely changed in order to face this epidemic. What we are really worried is to understand how is it that mortality rate appeared to be much higher than what was shown in China. And this, what we believe it may be really because of the fact that the structure and the aging of our population is much different than what is observed in other situations. And so that is what really concerning us. Actually, so far, the lethality rate has reached 6%. That is almost twice what was shown in China at the beginning of the epidemic. This is really concerning us a lot.
Really quickly, before I let you go, in your professional career, in terms of what you're seeing now, have you dealt with something like this before?
Absolutely nothing similar to that. Nevertheless, some similarities can be seen with what we experienced in the past with regard to HIV infection, with people get stigmatized because of this infection. And so we need also to fight this, the fear and the stigma that may be associated with this infection. I have many Canadian friends. I know that you also experienced a small but still relevant epidemic in SARS a few years ago. And I'm confident that actually we need to learn one another regarding previous epidemic, how to face with this situation. Healthcare system can fight it. We have the tool to fight. We are able to provide good assistance to the patients. But of course, we must not create the panic. Only the people that need, let me say, huge amount of assistance need to go to the hospital. The vast majority of people can be treated effectively at home. This is the message we need to give and make the people change their habits. It will end up as soon as we are able to change the lifestyle of the people and try to make the people protect themselves.
Such important information there, Dr. Giovianni Guaraldi. We thank you so much for your time. We appreciate everything that you and your medical team are doing to help these people. Thank you.